we all know, liver transplantation is the most effective method for the treatment of end-stage liver disease. More and more patients with liver disease get well therapeutic results through liver transplantation. However, complications after liver transplantation are relatively common, include biliary vascular infection and rejection. Among them, the biliary complication is the most common, usually reach 10 to 14%. We also called acute here because it often leads to the loss of transplanted liver function, and just about 6 to 13% of patients need to retransplantation. Okay, the biliary complication include stenosis, leak, bile duct filling defective disease, and so on. The bile duct stenosis accounts for about 60%. We usually divide bile duct stenosis into anastomotic stenosis and non-anastomotic stenosis, and their causes are different. There are many reasons for anastomic stenosis, include poor blood supply of bile duct, incomplete coincidence technique, diameter mismatch of biliary tract, non-anastomotic stenosis is always because of cold and warm ischemia of donor liver, virus infection, and chronic rejection. Asia Pacific consensus guidelines for endoscopic management of benign biliary strictures. ERCP is the first-line treatment for patients with anastomotic stricture and focal non-anastomotic stricture of bile duct. Endoscopic treatment as soon as possible is more effective. The experience from University of Pittsburgh, the treatment biliary stricture after liver transplantation include anastomotic stricture has changed from the traditional stage of surgical treatment to the new stages of endoscopic interventional therapy. ERCP has replaced surgery as the first choice, including balloon dilatation, stent placement, or nasobiliary drainage. Operation is only applicable to future of ERCP or liver retransplantation. Non-anastomotic stenosis often has multiple or diffused biliary tract lesions, and its treatment is more difficult. Endoscopic balloon dilatation and stent placement are still the first choice. The success rate of treatment depends on the degree, quantity, and the location of bile duct stenosis. However, the treatment effect of multiple strictures of hepatic or intrahepatic bile ducts is poor, while extrahepatic bile duct strictures are 50 to 70% effective for endoscopic treatment.